I am pleased to welcome our next speaker, Dr. Tennant. He graduated from the University of Texas Southwestern Medical School with a medical degree and is founder and director of the Tennant Institute for Integrative Medicine, a clinic specializing in the treatment of chronic pain patients with microcurrent technology. He's an international lecturer, has numerous publications on ophthalmic surgery and pain management. He's been training medical doctors and healthcare practitioners in pain management since the year 2000 and was interviewed for a PBS documentary in 2013. Please join me in welcoming Dr. Jerry Tennant.
Thank you. Okay, I guess this is working. Good afternoon. By the way, I got the memo that it's against the law in Puerto Rico to wear a tie, so I see some of you didn't get the memo. But since I've been wearing ties to giving lectures for almost 50 years, it's nice not to wear one day. So, how many of you have heard me speak during the past year? Majority of you. Maybe it's easier to ask how many of you have not. Okay, a few. Well, when Rich Fisher asked me to come speak here, I said, Rich, I don't think you really want me to come because, you know, I've been speaking at most of your last meetings. People are probably sick of me by now. Sort of like, you know, relatives and fish get stale when they're staying with you after about 4 or 5 days. Well, I was afraid that would happen. So I've been fretting about what it is that I can talk to you about today that you haven't heard that will make sense to you and something you can take home and use. As I was preparing this talk, which I finished about an hour ago, I was considering about the main things I see in my office, because they're really going to be things that are concerning you with your patients or concerning you with your family. And primarily I see people who are just tired all the time, have brain fog, and just have a hard time getting through the day. People with sexual difficulties, and people with cancer. So I thought it would be interesting perhaps to spend a little bit of time focusing on those particular subjects since they are so prevalent in our society. The other thing, of course, that I always try to do is to try to get people to begin to think in terms of physics instead of chemistry and in terms of the role of voltage. You know, it's always been incredible to me that physicians will readily accept an electrocardiogram or even electroencephalogram, but cannot get their mind around the fact that the rest of the body has voltage as well. I don't understand that, but so it is. But maybe it's because that, you know, dentists and we eye doctors are not real doctors because we're not really part of the body. And we're not too sure about those ear doctors either. So we suffer from the rest of the medical community sort of ignoring us as if we're not involved with the rest of the body. Having said all of that, I want to spend just a few moments, particularly for those of you who've not heard me speak, about the role of voltage. Now, I always start my lectures by announcing that I'm not speaking with my MD license. I'm speaking under the license of a private expressive association because in our country and particularly in Texas, physicians are not allowed to talk about what's science. We're only allowed to talk about what they tell us we can talk about. So I speak under the protection of a private expressive association. Obviously, I have financial interests in things that carry my name. I think I'm supposed to read this thing here that says, I do or do not have a financial interest of a product in my talk. Yes, I do. With any companies offering grant monies, no, I do sometimes get reimbursement for travel expenses, etc. So with that, I want to tell you that I'm convinced that we need a new medical paradigm, that the one that we're using for chronic disease just isn't working. The World Health Organization rates medical outcomes in the United States at it's about 34th to 38th in the world, just alongside Cuba as far as the results of our medical outcomes. Obviously, that's an unacceptable number. So I have suggested a different outcome for chronic disease. But before I suggest that to you, let me emphasize that for acute traumas and other things, if I have a car wreck and I've got a bone sticking out the side of my leg, please find me a doctor with lots and lots of drugs and a good anesthesiologist and a good surgeon to put me back together. And we do that pretty well in this country. But for chronic disease, we are basically pretty much of a miserable failure. And so the paradigm that has been and still is prevalent in our country is so-called standard of care, is that if you have an illness, you must find a chemical that'll make the symptoms of that illness go away. And if that doesn't work, then you surgically remove the offending part and throw it away. And if that doesn't work, you're out of bullets. Well, I'm suggesting to you that the proper medical paradigm should be that chronic disease occurs when you lose the ability to make new cells that work. So why is that? Well, most people are unaware of how rapidly we wear ourselves out and have to make new cells. You get new cells in the macula of your eye every 48 hours. The lining of your intestines replaced every 3 days. The skin that you're sitting in today is just 6 weeks old. Your liver's 8 weeks old, etc. So we're constantly wearing ourselves out and having to make new cells. So if you lose the ability to make new cells that work, then obviously you're going to develop a malfunction of that organ and eventually get sick and eventually die from that. So my paradigm then in my office is, if this person is sick with this problem, why can't they make new cells that work? And if I go through the checklist of what it takes to make new cells, I begin to identify the reason that they're sick. You know, one of the problems with all of medicine, whether you're talking about standard of care medicine or even alternative medicine, whether you're talking about an herbalist, someone using essential oils, a homeopath, an acupuncturist, or a standard allopathic MD, they very rarely ask the question, well, why do you have this problem? It's just, oh, you got that problem, therefore we use this treatment. And whether it's essential oils or whether it's digitalis or beta blockers or something else, nobody seems to get around to wondering, why did you get that disease in the first place? And you got that disease in the first place because you lost the ability to make new cells that work. So the common characteristic of people's loss of ability to make new cells is inadequate voltage. And just to give you some proof of concept, these pictures are from an internist radiologist in Kuwait. I never can figure out how to pronounce his last name, but it's Jera Al-Tubiak or something similar. And so here, for example, shows what happens with what's called the bowling ball syndrome, where you see that one rib is significantly higher than the other, and you take the biomodulator, you put voltage into the parasympathetic nervous system, and here you can see 2 minutes later they're level. And then here you can see the swelling in this knee, and treated here with the biotransducer, and here you can see a few minutes later that the edema is resolving. And here you can see a plantar fasciitis before and after the therapy of 30 minutes. You can see it began to abate. Same thing over here. And so we are beginning to accumulate significant evidence that the theory that voltage plays a significant role in all inflammation and in essentially all chronic disease is indeed correct. Now, in addition to having adequate voltage to make new cells, you have to have all of the nutrients that it takes to make cells work correctly as well. So if a tornado comes through and blows your house down and you have to rebuild that house, but you don't have windows and you don't have shingles, guess what? It's not going to be a very good house when you're finished, is it? And so it is with cells. We have to have everything that cells need to work. So people come to my office and I spend a couple of hours figuring out what's missing and what they need to do to get well, and I give them the protocol, and they come back 6 months later and say, you know, Doc, I'm not really any better than I was before. So I say, well, are you still taking your thyroid hormone? No, I don't want to get hooked on a pharmaceutical drug. Well, are you taking the iodine I suggested? No, I read on the internet iodine's bad for you. And so it goes. They've not done much of anything of the protocol I've suggested. And so I run outside and have a therapeutic shriek and come back inside thinking to myself, so why are you here? If you're not going to give your body all of the things it takes to make cells, nothing's going to work. And if you do it sequentially instead of all at the same time, it's not going to work either. You have to have everything that it takes to make new cells to work in addition to the voltage. Now, one of the problems I had was I personally got tired of taking 20 capsules of stuff every morning, and a lot of my patients got tired of it too. So I went through the physiology books and I wrote down everything I could find that cells need to work. And then I went to a biochemist and said, I want to put all of this stuff in one bucket so we don't have to take so many pills in the morning. And I don't want any fillers. I don't want anything artificial. Everything in here has to be pure and natural. Well, it took her nearly a year to figure out how to do it and to find the natural products, but we eventually did it. So now we have a system where people can just take this system and you, as a breakfast substitute, make a smoothie with it in the morning, and you know that you've fixed the nutrition part. And that's made my life and my patient's life much simpler. Then all I have to do is work out the voltage piece, which I'm going to be discussing with you. Now, if we look at the voltage, one of the fascinating things is that every organ in the body has its own battery pack. The reality is that the human and all other living things are portable electronic devices. And all portable electronic devices, as you will recall, have to have a battery system. And so it is that every organ in our body has its own battery pack. And the way that's accomplished is that our muscles are piezoelectric. That funny word piezoelectricity means that if you stress something and it emits electrons, that's called piezoelectricity. So every time I move my muscles, I'm generating electrons. And fortunately for us, our muscles are also rechargeable batteries. And because they're rechargeable batteries, when we move, we recharge our personal portable battery pack. So you can't get around the fact that we're designed to keep ourselves energized by moving. And there is no substitute. There's no substitute for exercise. Now, one of the interesting things about our muscle batteries is that they're surrounded by this shiny stuff called fascia. All of you have seen fascia when you carved your Christmas turkey. It's that shiny stuff around all the muscles. And one of the interesting things about fascia is that fascia is a semiconductor. So what in the world is a semiconductor? A semiconductor is a collection of molecules assembled in such a way that it easily moves electrons from one position to another at the speed of light, but only in one direction. So many of us have wondered, how is it that when you put an essential oil on your big toe, instantly you can feel the effect up in your head? It's because the frequency of that essential oil moves through the semiconductors we call fascia at the speed of light. So because we have the fascia surrounding them, the fascia is our wiring system and the muscles are our battery system, and that's the way the body is wired up. Now, the primary things that cause people to have low voltage and inability to make new cells are as follows. Many people in this country are hypothyroid, and that's rarely diagnosed correctly because doctors are trained to look at the thyroid stimulating hormone, or TSH, and sometimes at T4. But the issue is that T4 has to be converted to the active form of T3 and T2. And to convert it requires about 8 vitamins and minerals, and if you're missing one of those, you can't convert. So you can have a normal TSH and even a normal T4 and be 80% deficient at the cell membrane. So the other thing is that T3 controls the voltage of the cell membrane, whereas T2 controls the voltage of the mitochondria, which is, of course, intracellular voltage. And so that's why desiccated thyroid works much better than synthetic, synthetic, which is the most commonly prescribed thyroid hormone. But to get your thyroid right, you have to look at free T3, and if you're depressed, you should look at the free T3, reverse T3 ratio. Well, secondly, as I pointed out to you, these muscle batteries, if you put a scar across them that touches the fascia, it creates a short or a ground. So does anyone that's up close here have a scar that's, you know where it is, that you wouldn't mind coming up and let me just demonstrate something? Here's a lady that has a scar. If you'll come up here, I just want to show you how important scars are. And the interesting thing is we don't have to we can actually go right through the clothing if you just know where the scar is. So first of all, we're just going to test to be sure that she's testable. We'll put these two fingers together and tell her to be strong. Don't let me pull it apart, and you can see that she is. Now if we take these two fingers of her opposite hand here and put it on her scar, right, like that, you'll see, be strong now, that she can't do it. You see that? Be strong. See, I can easily pull those fingers apart. Now take it away, and now she's strong again, you see. Because a scar creates a short or a ground, and when you touch a short or a ground, it makes your whole body go weak. And so this scar goes right across her parasympathetic nervous system and also engages her lung meridian, and so those are both going to be low voltage until the scar gets fixed. It's easy to fix the scar. We put a little essential oil on it and use the biotransducer. And what I'm going to do, although we weren't able to get the essential oil here, compliments of our government security issues, we can probably make it fix. So if you'll go over there, Tamara, we'll fix that for you and come back and we'll see.
Which essential oil would you use?
I have a blend that's called Soreness that has the oils for muscles, ligaments, and bones. It works great. So scars, as you can see, create a short or a ground, and one of the interesting things that will interest this group is that, as you know, every tooth contains a pump that pumps fluid from inside the tooth to into the mouth to keep it from getting infected. And if you go back and do the history on people who come in with a dental infection, a cavity, and go looking through the same acupuncture circuit as that tooth, you'll find that usually when they were a child, they got the scar, and a year or so later, that's when that tooth had a decay, because the scars are capable of shutting down the dental pumps. And so decay in any given tooth is usually, in my experience, preceded by a scar in the same acupuncture meridian. Well, dental infections, as I'll show you, act like circuit breakers and simply shut down the voltage in that circuit and are the hardest to deal with. But the majority of people who come see me and have been sick for years, the primary reason that they've gotten sick are dental infections, either infections under a filling, under a crown, or even worse, root canals. So essentially all people with arthritis you'll find have dental infections, and you can tell which tooth is causing it because you can tell look at the joint or what circuit that's in, and that's the tooth that'll be infected. Essentially all autoimmune diseases are due to dental infections. Once you get the teeth cleaned up, you'll see their ANAs go back to normal, their rheumatoid factors go back to normal, etc. So almost all of those so-called autoimmune diseases are due to dental infections, and we'll talk more about that in a moment. Lack of fulvic acid. Fulvic is a strange but important phenomenon in the body. Fulvic is a combination of organic acids that has control of the voltage at your cell membrane, and also has control of what goes in and out of the cell, particularly all the vitamins and minerals. The other fascinating thing is that our emotions are stored as magnetic fields in the brain and affect a given acupuncture circuit. So one of the fascinating things about these emotions that are stored as magnetic fields is I often see people come in who are deficient in adrenaline. And people who are deficient in adrenaline will have the following symptoms. They can't deal with stress, they have trouble with their memory, and they can't multitask. So you're sitting and reading a book and somebody says, hey, do you want mustard or mayonnaise? You become annoyed because they interrupted you, but you don't have enough mental energy to make the decision until you detach from your book. So you detach, decide you want mustard, you go back to your book, and now you can't remember your place, and you're even more aggravated that they interrupted you. Plus, you can't stand any stimulus, so you don't like loud noises, loud music, rowdy crowds, people who are arguing. And eventually it gets to where you don't even want to be touched. You just want to sit in the corner and have people leave you the heck alone. And then your sexual equipment quits working, and then you can't go to sleep before 11 and you wake up tired. All of those are symptoms of lack of adrenaline. Now, to make adrenaline requires the amino acid tyrosine plus vitamin C and vitamin B6. But even if I give you those things to make it, most people don't get well from that until I remove the emotional blockage that's in that circuit. So almost always when I find that people have deficiency in adrenaline, and by the way, a quick test for that is simply take the blood pressure. If the diastolic pressure is under 80, you can pretty well take it to the bank that that person's deficient in adrenaline and has all those symptoms I just mentioned. Quick and easy test. Well, the way you can easily remove these magnetic fields that are emotional blockages is that you help the person remember what it is. And because I don't need to know, I just need for you to know, if you can figure out what the emotion is, then in less than 10 minutes I can erase it using the biotransducer and a biomodulator and some specific frequencies. So I'm not sure that I'll have time to demo that, and of course a big setting like this is not ideal to deal with an emotion, but perhaps if some of you want me to demonstrate that to you, I can do it somewhat time later in the day where it's a little less time compressed as we are in this lecture. But what I find is that releasing those emotions with the biomodulator is one of the most effective things I know how to do in getting people well and getting their lives back. Because people who have lack of adrenaline, as I just described, their life's in the toilet. If every time somebody wants to interact with you, you get snippy or even angry and start yelling, guess what? You can't be a good mother, you can't be a good father, you can't be a good spouse, you can't be a good worker. Nobody wants to be around you. And of course, if you happen to be a parent, you've got a real problem. You know, my favorite definition of a boy is a noise with dirt on it. And if you have a boy who's noisy and you can't stand any kind of stimulus, guess what? You're in a heap of trouble, aren't you? So getting that fixed is a major thing, and it's easy to do by erasing these magnetic fields. Well, the primary things that damage cells are dental infections and heavy metals. Now, just to get a grip on this issue of voltage, remember that pH is potential hydrogen and is a measurement of voltage in a solution. So the electrons that are illuminating the light bulbs in this room are conductive electricity, and the switch is on or off. But in water, like this bottle of water, I've got stuff down here someplace, this has the opportunity to either be an electron donor or an electron stealer. And the way you measure voltage in a liquid is you put a sophisticated voltmeter like that one in here, and it will tell you what the voltage is, and it will also tell you if it's electron donor or electron stealer, and then convert that to a logarithmic scale called pH, and pH goes from 0 to 14. So plus 400 millivolts of electron stealer is the same as a pH of 0, and minus 400 millivolts of electron donor is a pH of 14. So if we look at this slide, you'll see, first of all, the colors on here are the colors you see on pH strips, and then you can see the comparison between cell pH and cell voltage. So every cellular biology book will tell you that cells are designed to run at a pH of 7.35 and 7.45, which is a synonym of minus 20 to minus 25 millivolts. Now people get confused because they say, well, I read that cells run at a pH of minus 90 millivolts. Well, if you put a cell inside of a petri dish and put an electrode inside the cell and one outside the cell, yes, indeed, you'll measure minus 90 millivolts. But how many of you have your own personal cells in a petri dish? So it's the environment of the cells that we're talking about at minus 20 to minus 25 millivolts, not the transmembrane potential. Now, the thing that is important to realize is that you have to have minus 50 millivolts to make a new cell. So if you look at my thumb here, it's a perfectly good thumb at minus 25 millivolts, but if I hit it with a hammer and destroy the cells, then the thumb will automatically go to minus 50 millivolts. And the reason we're designed that way is that we need that extra energy to make cells, plus at minus 50 millivolts, the arterial capillaries will dilate. And the reason they do that, obviously, is to dump the materials at the curb that you need to make new cells. Well, when those arterial capillaries are dilated, then we have all of the signs we've come to know as inflammation. We have redness, we have swelling, we have a pulsing pain, and it makes us say bad words. So when you have all of that happen, you get busy, you make all the cells, you need to replace the cells you damaged with a hammer, and the thumb quickly goes back to normal and everything is great. But the problem is, if you didn't have enough voltage to get up to minus 50 millivolts, then you can't make the new cells, and you end up down here, which is chronic disease, where no matter how many pills you take, how many vitamins you take, how many surgeries you have, you can't get well because you can't do what? Make new cells. So, and you can't make new cells because you don't have what? Enough voltage to do it. So what I told you earlier is that chronic disease is always characterized by a lack of adequate voltage to make new cells. Now, there are several bad things that happen when you don't have voltage. Here we are at minus 20, minus 25 millivolts, but as voltage begins to drop, we get tired, we get sick, and things keep getting worse until at plus 30 millivolts you develop cancer. And I'm going to be spending some time talking to you about that in just a moment. But if we look at what things happen when voltage begins to drop, is that, as I mentioned, the amount of oxygen that will dissolve in water is dictated by the voltage of the water. And so when voltage is low, then oxygen is low. So our cells are 70% water, so as the voltage drops, the whole oxygen comes out of the cell, and you begin to have less and less oxygen. And by the way, for those of you who are involved with hyperbaric oxygen, as I am, or involved with ozone, remember that the half-life of the oxygen you put into tissue is 24 hours. So if you come in and I put you in the hyperbaric tank, or I give you ozone, and have 100 times as much oxygen in your plasma as you did yesterday, this time tomorrow you'll have 50 times, this time the next day you'll have 25 times, and so in just a matter of 3 or 4 days you're back to ground zero again. So it doesn't last very long. I think that's critical for those of you in dentistry who consider injecting ozone into sockets and gums and other things that you do, is to remember that the patient may get well, but if that area doesn't have adequate voltage, it's going to get sick again, because that's the half-life. That's why we have a problem in the hyperbaric community. It's wonderful people get well, but then they get sick again, because no one's addressed the question, why was the oxygen levels low in the first place? Well, because the voltage is low. Why was the voltage low? That's what we're discussing. Well, the other thing is that inside our cells, of course, we have a rechargeable battery system that provides the voltage for what goes on in the cell. And that's called ADP when it's discharged, ATP when it's charged up. And so we need a battery charger inside our cell, which is the Krebs cycle. So for every unit of fat you put into the Krebs cycle, if oxygen is present, you get enough electrons to charge up 38 of these batteries. If oxygen is unavailable or low, for every unit of fat you put into the Krebs cycle, you only get enough electrons to charge up 2 of those batteries. So it becomes very inefficient. And of course, the other thing that happens is that each of us contain about 1 trillion bugs. And these bugs are suppressed as long as we have adequate oxygen, but as soon as the oxygen drops, these bugs wake up and want to have lunch, and they want to have you for lunch. Since bugs don't have teeth to take a bite out of cells, they put out digestive enzymes to damage cells so they can get the nutrients out. And those digestive enzymes get in the blood and go all over the body, causing damage. And when that happens, we call that an autoimmune disease. Autoimmune diseases, in my opinion, do not really exist. They're simply these bugs that are having their way with you. But most of these bugs, because the oxygen levels are low and the voltage levels are low, have shed their cell membranes, so they don't, you can't culture them, and they don't cause any of the signs of infection, such as elevated white count, a left shift, any of those things. So here you can see the bugs that occur. You can see them inside the red cells here with these phase contrast microscopes. You can see that this white cell can't even see them as they go cruising by. And here's a spirochete. Here is a 15-year-old girl who had known Lyme disease. I put a drop of blood on the slide. I got called away before I looked at it, so I set it down, came back about 5 hours later to look at it, and you can see the spirochetes crawling out of her red blood cells as the oxygen disappeared. Now, as voltage keeps dropping more and more, fungus always shows up. The Germans have shown very clearly that you have fungus in your blood 2 years before you can diagnose cancer any other way. This was my office manager who developed leukemia, and you can see the fungal forms in his blood, and we'll talk more about those in just a moment. This is a microscope that's capable of seeing up to 40,000 power, where standard microscopes can only see up to 1,000 power, and I want to show you the fungus that shows up in malignancies. There it is right there. So these are the fungal forms, cell wall deficient fungal forms that show up in malignancies before you can find cancer any other way. And as I mentioned, you cannot culture these unless you add antibiotics to the culture medium. That's scary, isn't it? The only way you can get these bad bugs to show up is give them antibiotics. So the only way you can kill these guys is with oxidative therapies, raising the voltage or oxygen levels, or the use of specific frequencies like radiotherapy and homeopathy. Well, let's see, I've got, I think, 30 minutes left. Is that accurate? Yeah, okay. So I wanted to give you a case report just to help demonstrate the role of voltage and the role of dental infections in chronic disease. So here we have a 50-year-old male begins to notice increasing fatigue and mental fog over a 2 to 3 year period, increasing inability to deal with stress, insomnia, can't remember an entire phone number when dialing, had GERD, a visit to the internist reveals nothing, SpectraCell blood test reveals low levels of vitamin B12, blood test for B12 levels confirms low level, and a platelet count of 43,000 with normal 150 to 350. Hematology consultation results in a bone marrow test. This reveals an active marrow with no malignancy. Started on prednisone 80 milligrams a day with no effect on the platelet count. Prednisone causes severe weakness in the legs and increased GERD. Started on Prilosec for that. Progresses to overwhelming fatigue and confusion, including inability to find way home. Started on Effexor with no improvement in mental confusion. Developed idiopathic neuropathy in the left foot. Periodic pain in the left upper abdomen and aching in the left maxillary sinus. X-rays are normal. Developed double vision. Examined by 3 ophthalmologists, can't find the cause. Worsening of platelet count accompanied by petechia of the feet and ankles. Constipation. Postural hypotension. Can't stand loud noises, rowdy crowds, people arguing. Does that sound familiar? EEG reveals evidence of encephalitis. Told that nothing can be done. Measurement of the acupuncture points reveals low readings and an indicator drop in the spleen and stomach meridians. Application of the microcurrent biphasic pulsed and dampened begins to correct the readings as symptoms involved. So when I see a patient with chronic disease, I always ask the question, what is the power supply for the symptoms the person's complaining about? So if you come in complaining of angina, and I ask the question, what's the power supply to the heart? That's an easy one, isn't it? It's the heart meridian. But and so if you go back and look at this, at the power supply for each one of these symptoms that I just gave you, you'll begin to see the pattern. Fatigue involves the frontal lobe and the thyroid. That's the spleen meridian. Can't deal with stress. The adrenals are on the spleen meridian. Insomnia, adrenals and lack of stomach acid. That's on the stomach meridian. Memory, adrenaline and stomach acid. So that's spleen and stomach. GERD is the stomach meridian. Brain fog is and lack of B12 is the stomach. Low platelets. Beginning to see a pattern. So once you identify the power supply for each of these symptoms, you begin to see the pattern of what's going on. And then the next thing you do, once you figure out, okay, this has to be a spleen-stomach circuit, then you simply follow the spleen-stomach circuit from one end to the other looking for a scar. If you find a scar, you fix it. Then you go looking at the teeth. and look at the teeth that are in that circuit, because all of the acupuncture meridians go through specific teeth. And in this case, the spleen and stomach are the yellow ones, so it's upper molar or lower premolar. And of course, you have to fix thyroid and adrenals in almost everybody, and oftentimes emotional blockages. And here you find that the cause of all of those symptoms was a root canal in tooth number 14, which is a stellene stomach circuit. So the platelet count got as low as 30,000, which is where you begin to bleed and can often bleed into the brain and get into serious trouble at around 30,000. So that tooth was removed. As soon as the dentist pulled the tooth, the infection in the socket splurted all over her mask. That's how much infection there was. And she cleaned out this mess, and 48 hours later, a repeat platelet count was normal. So the platelet count went from bleeding, dangerously bleeding level, to cured in 48 hours by simply pulling this root canal tooth and fixing the cavitation that was associated with it. And of course, one of the problems was the double vision. And here you can see what happened to the retina. This is a normal retina. This is what happened to the retina because the infection in this circuit caused scarring along the top of the retina, where the vitreous became inflamed and scarred and simply pulled the retina apart. And pain in the left big toe was because that's where the circuit is. So here's the spleen circuit, starts down in the big toe, goes up the inside of the leg. A special branch goes to the reproductive in the entire endocrine system, comes up the back, goes up the neck, and then it goes to the frontal lobes of the brain. So the frontal lobes of the brain gets its voltage from a combination of spleen and stomach, and so that's where the mental confusion comes in. And then the stomach circuit goes back south. Here you can see the frontal lobes around the eye, including the macula of the eye, around the mouth, through the teeth, down the neck, and all the way down to the big toe. And by the way, that case was me. So one root canal put me in bed for 7 years. I slept 16 hours a day, had 2 or 3 hours a day in which I could think, and the rest of the time I couldn't even understand a newspaper. So all it took to cure me was to get rid of the infection in that one tooth, which cured that whole bevy of symptoms. Now, the thing I want to be sure you understand is that I don't know of any other system of medicine that can explain pain in the left big toe, double vision, and confusion, and all of those other symptoms, unless you look at it through an acupuncture circuitry voltage paradigm. And so I find that when people come in with all of these what seem to be unrelated symptoms and are confused about no doctor can figure out what's going on, it's because you don't look at the circuit. And it's the power supply for the circuit that will tell you what's going on. So I have come to believe that dental infections, whether it's an infection under a crown or a root canal tooth, is a circuit breaker that shuts that circuit down. And it's my experience that I can never get people well unless I can get them to a biological dentist that will get the infection out of their mouth. So the idea that you can get away with leaving a root canal in the mouth, I disagree with firmly. And obviously I have personal experience with it myself. I spent 7 years in bed because of it, which kind of gives me an attitude about that. But it's been my experience in my office. The other thing that I would point out is that I did a study about 7 or 8 years ago at an oncologist's office in Arizona. We looked at his cancer patients and found that 70% of his cancer patients had a root canal in the same meridian as their primary cancer, and 30% had an infected crown, decay under a crown. So in that series of patients, we had 100% correlation between a dental infection and a malignancy. In my office, we now have 60 patients that have cancer, and we have 7 of those patients which we could not identify a dental cause, but we were not able in all of those 7 patients to get a cone beam scan, so the numbers may be higher. But even if we say that 90% of our malignancy cases are associated with an infected tooth in the same circuit, it becomes extremely interesting, doesn't it? So What people need to remember is that the balance of electrons in a circuit is associated with how many electrons are you putting in versus how many are you consuming. Sort of like your checking account, right? How many dollars you're putting in, how many checks you're writing. And so if we see here the balance of things, so as the scale tips this way, we go into plus, which is electron stealer, in other words, inadequate voltage, and at plus 30 millivolts, we're going to get a malignancy. When it goes this way, we get minus voltage. So dental infections, hypothyroidism, scars, emotions, toxins, smoking, pesticides, pharmaceuticals, and so forth cause us to lose electrons, and all of these things over here cause us to gain electrons, and so it's always a balancing act. Because I'm going to run out of time, I'm going to skip this portion about, well, maybe not. Won't take me long to tell you. Everything in the universe is energy. So we really should be thinking about energy in physics rather than chemistry, because all of chemistry follows on the energy of physics. So when two hydrogen ions want to get together with an oxygen atom to make water, the first thing they do is share electrons. And the movement or sharing of electrons is physics. It's not really chemistry per se. Now, the way energy is concentrated in the universe is in a star tetrahedron. If you take two pyramids and put them base to base and then slide them together where they'll fit in a circle, you have what's called a star tetrahedron. And star tetrahedrons, if you put them 64 of them together like this, you form a unit which actually fills all of the space of the universe. Everything that is considered to be vacuum is actually filled with star tetrahedrons. And the reason that's important, other than the fact that it explains why you can know that the phone's going to ring before it rings, is that everything's connected through this energy, and this pattern of things causes an implosion of energy into the center of it like this, and so that's what contains and holds the energy. And everything in the universe, including those star tetrahedrons, are fractal. So for those of you who don't understand fractal, I don't have time at this moment to explain. But one of the things that's fascinating to me is that if you look at the patterns in the heart chambers are basically pyramids. This one's upside down, but you can begin to see, and also in the uterus, you can see that you have a pyramid here and another one down here. And so it's perhaps interesting to note that in an embryo, the blood begins to move through the vessels before the heart ever starts to beat. Did you know that? How is that possible? It's because the heart compresses energy. It implodes energy into it, enough energy to move the blood before the heart has to beat. And here, of course, is the place where life is created. Where else might we need implosion of energy, right? Except where life is going to be formed. So for me, that's a fascinating thing to understand the relationship, the way the whole universe, and why these things are designed in such a weird looking way unless you understand the physics of it. Well, let's look at the polarity of the body, because that is a thing that also helps us understand that the voltage is indeed an important part of the body. So I'm wondering if I could ask somebody up front, maybe this young lady, would you mind coming up and helping me for a moment? Thank you. So what I'm going to do is show you that polarity does exist and is an important part of the body. And so here we can see let's see, there's steps over here, if you don't mind coming up for a moment. So here you can see the polarity of the various parts of the body. Notice that the right side of the body is different from the left side, and it changes at the level of the diaphragm. So here we got minus and here we got plus, and so forth. So the minus is the electron donor portion. So one of the things that I want to show you is I'm going to step over to this side like that. Good. Since I'm taller, I can even get down here. Now we're going to put this arm out like that and have her press down. I mean, don't let me push it down with my one finger. You can see she's nice and strong. Now what is the voltage in her right palm? Not the voltage, the polarity. Plus, right? And what is the polarity right here? Negative. So we're going to take this hand and we're going to put it plus to minus. You agree with that? Plus to minus? Now we come over here. Now, be strong. Now we're going to take this hand and we're going to put it right back here, like that. So now we've got plus to plus. You see that? And guess what happens? Be strong. Come on, be strong. Now put it back up here. Be strong. See the difference? So polarity matters. Now, there's a lot of things that happen in our society that relates to polarity without us ever knowing it. Now, one of the interesting things is the handshake. So what's the polarity here in my right hand? Okay, it's plus, right? See that, my right hand? What's the polarity in her right hand? It's plus, right? So people shake hands, but they don't keep their handshake going very long, and the reason is the polarity is wrong. I got plus to plus. So the idea of handshake comes from back when people said, look, I don't have a sword in my hand or a knife. I'm not going to kill you. I'm here in friendship. But you don't hold it very long. But now look what happens. Let's say that she's my girlfriend and we're going for a walk. Now what have we done? Plus to minus, and that's why it feels great, right? Because of the polarity. Now we go dancing. Okay, now what have we done? Same thing, plus to minus, you see that? So essentially everything we do to interact with each other, we do unconsciously because of the polarity. Now, does anyone have a watch with a battery in it? Do you have a watch with a battery? Let's see if I can steal somebody's watch. Anybody got a watch with a battery in it? No batteries? Here we go. Thank you very much. So if I have her take this watch with a battery in it and hold it right into her main magnetic field, you're going to see that she's very weak. You see that? Okay, give it back to me. Now if I put it on her wrist like this, it's far enough away from her magnetic field that she's only a little weak. She can get away with wearing it out here. But when you put it up there, hold it in that hand up against that, and be strong, you can see she can't possibly do it. Now there's another fascinating thing that has to do with our intention. So I just intended to make her weak, and let's see if I did it. Be strong. Come on, be strong. Shall I leave her this way or turn her back on?
Please.
Okay, now be strong. So my intention is very powerful, isn't it? You see that? Would you give this watch back to that lady right there? Thank you for your help.
Thank you.
And we'll go dancing anytime you like. So, in the 10 minutes that I have left, I want to just share with you a theory that I have about what causes cancer. Now, I want to emphasize two things. One is that this is a theory that I've only figured out in the last few weeks. Whether I'm right or wrong, I have no idea. And the second thing is I'm not an oncologist and don't claim to treat cancer. But I want to give you some things that we know, and some of these things we've known for more than 100 years, but have ignored. And it relates to the on-off switches for cancer. So why do we need to think about cancer? Well, first of all, we are doing a terrible job of dealing with cancer in our country. Here's data from the American Cancer Society from 1972 to 1994, and you can see there was no change in that 20-year period. In males, and females got worse. But here's even more recent data from the American Cancer Society showing that from 1930 all the way up to 2002, we really overall haven't made any progress in treating cancer. We can see that stomach cancer has gotten better, but lung and bronchial cancer has gotten worse. And so this is not very impressive. And this, by the way, is for males, and the pattern is essentially the same for females. Again, since 1930, we've done very little to get rid of the cancer rates in our country. So when you see people say, We have more and more cancer survivors. Aren't we doing a wonderful job? That's what the White House calls spin. The reason we have more people surviving cancer is we have more people having cancer, not that we're curing more. So if you look at the trends in cancer deaths, again, this is U.S. mortality data from the National Center for Health Statistics. You can see from 1930, the amount of cancers just keeps going up and up and up and up. So I won't have a lot of time to tell you about what people do with statistics, but almost all medical studies are reported in what's called relative risk instead of absolute risk. And basically, if you look at the absolute risk reduction in cancer, the absolute risk is 0.0023%. And that's from 2007. And the trend began in 1991. The point is, we're doing a lousy job of taking care of cancer patients. And so, even though you see that advertisements that say the cure rate is 50% or higher, it depends on how you define a cure. Often the cure in cancer is defined as if at any point in the treatment the tumor got smaller, you go to the cured rate, and even if you die a month later, you're still in the cured column. Well, that's not really quite the way to do it. Here are all the chemotherapy agents that were approved by the FDA in the 1990s. And here's the average mean time to death is 7.6 months in the best and newest cancer therapies that we have. So the point is this one, and this is a study that came out of Australia, the contribution of chemotherapy to 5-year survival in Australia and the US, and they found that the contribution to chemotherapy to 5-year survival was 2.3% in Australia and 2.1% in the US. That's sort of underwhelming, isn't it? Well, of course, the idea about cancer changed dramatically in 2013 when Thomas Seyfried, in his book, Cancer is a Metabolic Disease, showed that genetic changes are not what's responsible for cancer. You know, as long as I've been in medicine, which has been since 1964, we've been taught that it's genetic changes that makes the cells go crazy and start making tumors and eventually kill us. What Seyfried and his group did in Boston was to take the nucleus out of a cancer cell and replace it with a normal nucleus, assuming the cell would go back to normal. It did not, it stayed malignant. Then he took a normal cell, removed its nucleus, and put it in a cancer cell, assuming it would become malignant. It did not, it stayed normal. And then this was repeated at 6 other universities, showing that it's not genes that are driving the bus. He also showed that in all of the cancer cells, the voltage was low, namely low ATP, with damage to the mitochondria. Also, of course, it's critical to remember that voltage in the cell is controlled primarily by what? Thyroid hormone T2. Now, Keith Brewer published this work, I think it was in the 1980s, showing the relationship between of the pH of normal cells and cancer cells. And what he showed is that if you put cells into a petri dish and began to drop the voltage, the cells become malignant when it reaches plus 30 millivolts. Now, he just described it in terms of pH. He just said basically that cancer occurs at a pH of 6.5, as you can see here. And then he raised the voltage, and when he got it up to a pH of 8, which is minus 60 millivolts, the cancer cells all died, but the normal cells stayed normal. Then we have Otto Warburg, of course, got his Nobel Prize for showing that cancer cannot exist in the presence of oxygen. And remember that oxygen levels are controlled by what? Voltage, right? So as oxygen drops, the cell wall deficient fungus appears to show up in damaged cancers, as I showed you earlier. So again, when voltage drops, oxygen drops. When oxygen drops, these cell wall deficient fungus shows up and starts damaging things. Now, one of the things that is of some interest is that if you go back to the late 1800s and beginning his publication in 1902, John Beard, a Scottish embryologist, said the following: embryos begin to grow inside of a sac, but the cells that make the placenta are outside of the embryonic sac. Second thing Beard said is that the cells that he named trophoblasts, which by the way have now been shown to be exactly the same as embryonic stem cells that make a placenta are outside of the sac and begin to invade the wall of the uterus and make a blood supply and develop a tumor, namely the placenta. And then the placenta begins to stand down and the cells quit acting like cancer. And so Beard believed that cancer does not occur from normal cells, but only from embryonic stem cells. And so Beard was interested in why it is that day 52 to day 54 of the pregnancy, the cells that are invading, creating a new blood supply and creating a tumor, stand down and quit being malignant cells. First he assumed it was from the mother, but just couldn't find anything, and so he started looking at the embryo and found that on that particular day the fetus's pancreas began to start secreting. So he goes to the slaughterhouses, squeezes the juice out of pancreases, injects that juice into cancer cells and cures them. So in 1902 he publishes his book, the enzymatic treatment of cancer. Well, at approximately the same time, Madame Curie in Paris had discovered radiation, and she published that radiation is perfectly safe and easily kills cancer, so everybody ignores Beard's work for the next 50 years. 50 years later, a surgeon in Dearborn, Michigan named Frank Strickland began to inject pancreatic enzymes into cancer patients, cured 192 of them, which prompted the FDA to outlaw the use of injectable pancreatic enzymes. Approximately the same time in Dallas was an orthodontist named William Kelly, and William Kelly himself got pancreatic cancer, was beginning to realize he was going to die from it, started taking oral pancreatic enzymes and cured himself, and began to treat patients with cancer. One of the local Dallas physicians complained to the dental board, so they took his license away from him and forced him to move to Mexico. Then a few years later, there's a medical student at Columbia named Nicholas Gonzalez. He was required to write a thesis in which says, I'm out of time, but may I have five more minutes? He goes in to write his thesis on Kelly, finds that Kelly was indeed treating cancer, wrote his thesis, nobody would publish it, and his mentor got fired from his teaching position for allowing Kelly to write it. So these four different docs showed that you could make cancer go away with alkaline things such as amylase. I began to wonder what it is that tells a pregnant woman that she needs a placenta. How does the body know she's pregnant? Well, it turns out that that sperm and the egg are a pH of 7.35, as they're supposed to be, minus 25 millivolts. But if a sperm finds itself in the presence of high levels of estrogen, it opens cells on the holes on the side of the sperm, dumps out hydrogen ions, and converts the polarity. Isn't that neat? So that's the way that the embryonic stem cells in a woman says, hey, we're pregnant, go make us a placenta. And then, of course, the embryo begins to make amylase, which is the most alkaline thing the body knows how to make, which clicks the polarity back to normal, and the cells stand down. And so the theory that I have is that all cancers, including in men, is that the polarity gets flipped and that the embryonic stem cells that are present in all of our organs say, oh, we're pregnant, let's go make a placenta. But in men, the switch never gets flipped back the other way, and in most women, when because they're not pregnant and they don't get this surge of electron donors, the body just keeps making a placenta, namely cancer, and that occurs in every organ. So again, this is a theory that I have that seems to fit everything that I know about cancer, and we've just begun to give our patients, well, first of all, one of the things I want to leave you with is that I don't think you can ever overcome a dental infection. I don't think you can get cancer patients well unless you get the infection out of the tooth in the same circuit. In my experience, it never happens. So one of the things I personally am doing and would suggest for your consideration is go ahead and take digestive enzymes because, as Kelly showed, if you do take big doses of them, that between 3 hours and 2 weeks, if you get a Herxheimer, you can be sure you just destroyed a tumor someplace. So I figure, why not? I'm going to do it every year, and hopefully I'll be back here lecturing to you when I'm 103 instead of just 75. Thank you for your time.
Thank you, Dr. Tennant.